Dr. Mitrevolis, thank you for joining us for this episode of Addiction Talk. I think this is a very important topic because, with all of the states out there that have now legalized recreational marijuana, I think there's this perception out there that it is harmless in comparison to other drugs. So for you, as someone who treats addiction and is very familiar with this drug, cannabis or weed, as it may be called by others. What is your take on cannabis?
Yeah, Joy, thank you for asking. So I would say that it is not entirely harmless. And with more widespread and prevalent use, we're actually seeing more and more consequences to physical health, to mental health, as well as to just overall functioning. There's been studies out there now showing, recent studies showing increased rates of heart attack and stroke with regular cannabis use. There's been some evidence of increased symptoms of anxiety, of psychosis, of mania. There have also been some studies out there showing how it's affecting people's judgment, their memory, their overall cognitive ability. And there's also some data out there in people that are pregnant or lactating that there's been some effects to the baby in terms of decreased birth weights, certain impairments in mental development, as well as symptoms of hyperactivity that could persist even in their adult lives.
So, how would you compare it to other drugs that are out there? Because people hear that, but I think there's still this messaging that it's okay, it's legal in some states, it must be safe, even though they're hearing some of the research that is out there that you just presented to us. How do you compare it to other drugs?
I would say it has the potential to be just as harmful as many other drugs out there. And just to go back to your last point, alcohol is legal, yet we all know the dangers of alcohol, and more data about the cancer risk with alcohol is coming out. Now, with cannabis, I think that its widespread use is fairly new, yet I would say it's quite alarming. Of what's coming out already in terms of how it can affect our overall mental health as well as our physical health. So I would say, comparatively speaking, it is not something that's entirely safe or benign.
I think a lot of parents out there or older generations think that the weed or the cannabis that's out there now is similar to what they smoked or used or tried or experimented with years ago. And I think there's a disconnect there. What would you say in terms of what we're seeing on the streets these days compared to, decades ago when people were like, well, it was no big deal. Everybody experimented.
And that's a very good point that you brought up. So back in the day, in the 60s, 70s, we're talking about grandma or grandpa's reefer. The THC content, which is really the active component in cannabis, was actually around maybe 2 or 3%. Okay. Whereas these days, especially with techniques that people are using, such as vaporizing the cannabis, vaporizing the actual oils itself, as well as certain kind of breeding techniques with the actual plant itself, we are seeing THC concentrations of up to 90%. And that is significantly higher. And I'm just alarmed by that because with that high of a concentration, I'm particularly concerned with its increased effects on somebody's mental health.
Mhm. That is a significant difference. When you're talking about we went from 2% when we're thinking the 60s and the 70s to potentially 90%, that is something I think a lot of people don't know. Another thing that I think is really interesting is that sometimes people think they're getting just weed, but other drugs are making their way into, you know, weed or things like that, that people think they're just getting this one drug. Are you seeing that more as well?
It's not as common, but what I have seen is I've probably seen a couple of cases of this actually, in which people that are strict cannabis users, when we're doing their urine tox screens on them, I've actually seen a couple of cases of fentanyl showing up. And now that is very, very alarming because, as we do know with the opioid epidemic, fentanyl is a highly potent opioid and is lethal. Like, even 1 in 6 people that regularly use opioids are at risk at overdosing and dying from it. So that risk is much higher in somebody that's naive to opioid use. And so that's why I'm very, very kind of worried or alarmed by seeing the potential adulterations, especially with fentanyl in cannabis. But I would say overall the frequency is low, but there's always that concern.
I think that is definitely something that people need to keep in mind when they're looking at this. And I want to go back to some of the things that you said about the impact. You talked about the impact on mental health. And I think that is a big component that people are thinking about. They've
Yes.
heard maybe that cannabis can have long-term and short-term impacts, including psychosis. Let's just break that down for people a little bit more. What is the risk or the potential for having some type of mental health reaction to cannabis use?
So a very well done study has shown a strong correlation between regular cannabis use beginning in adolescence, that have led to expression or symptoms of psychosis. And this is especially worrisome in people with a family history of psychosis. In fact, the study has shown that in adolescents that begin regular and chronic cannabis use with a family history of psychosis, they actually have a 5-fold increase in the possibility of developing symptoms of psychosis. So this is actually very, very, very alarming. And I fear that with the increased THC content in cannabis, that might actually increase, might make it even higher than 5-fold.
Let's talk about psychosis because a lot of people hear that. And what does that mean when we say psychosis?
Yeah, so that can range from paranoia or certain types of delusions of being persecuted to symptoms such as hearing voices, hearing things that aren't there.
So that can be significant for a lot of people. And are we finding that if they have that initially, is it something that continues to last long after the cannabis use? Or is it something that is, you may experience that while you're using the drug?
No, this is something that would continue even after cessation of cannabis, especially with the family history of cannabis use. So, for some reason, and the mechanism isn't fully understood yet, is that it can increase the chances of these symptoms being expressed, and once expressed, they're there.
Oh, wow.
Yeah, yeah.
A lot to think about because I think so many people don't even look at this. And when we think about, the cannabis use, the mental health part of it,
Mhm.
do you see it's any different with different types? So people might be like, "Oh, I just had an edible," or, versus smoking it versus, now they even have some liquid drinks that
Mhm.
have cannabis in it. Is
Mhm.
there a difference in how the body reacts to it or is it all the same?
There's actually a big difference. So one thing I want to say is that when people are using cannabis in the edible forms, there is a higher number of emergency department visits due to the effects of the acute intoxication. And the reason perhaps being is that there's a latent onset of effect. So if you consume an edible, typically you'll feel your symptoms perhaps 30 to 45 minutes after you last consumed it. And so what that means is people can consume more and more and more, and so that would cause increased severity of their symptoms. Whereas when you inhale it, so when you smoke it or when people are vaping it, the onset of symptoms typically is within a minute. And so they kind of know how they're feeling. And so, yeah, there has been shown an increased number of emergency department visits with the use of the edibles.
with people using those, what are they showing up with? Is it the symptoms of psychosis, or are they having other effects that are leading them, once they're trying the edibles in the ER?
So there are many different symptoms, but the most common ones can be impairment in their judgment, their concentration. There could be increased paranoia, which goes along with the symptoms of psychosis. Hallucinations aren't that common, but still can occur, especially with the higher THC content. But there tends to be a lot more paranoia that occurs. People also have slurred speech. They'll have impaired coordination. Their heart rate will go fast, and they'll have the other symptoms like the red eyes, the dry mouth, and things like that. But in terms of the mental effects, it's more their ability to think, to concentrate, that's impaired. They'll just have that increased paranoia as well.
Mhm. Let's take it from here, because I think this is some very important information that everyone needs to know and be aware of, but also thinking about the potential for addiction with cannabis. That has been a huge debate for years. People are like, well, you can't get addicted to cannabis. That can't really happen. You're fine. I mean, of course, you may have these other symptoms, but in forms of addiction or becoming dependent on it, that's not going to happen. And I believe that's a myth that a lot of people don't realize. Can you address that?
That is 100% a myth. An addiction does develop, and several well-designed studies have shown that addiction to cannabis can develop. So when we talk about addiction from a medical standpoint, we use the term a use disorder, okay? And so in order to diagnose a use disorder, we use the DSM-5 criteria, okay? And there's typically 11 points in the DSM-5 criteria, but just to break it down even simply, it's really based on 3 domains. One is you've lost control over use, okay? So that's one main domain. Another major domain within that is how it affects people's functioning, like their relationships, how it affects their ability at work or at school, affects their finances. And then the last major domain is the physical dependence aspect of it. So like if you stop using it, you start to develop withdrawal symptoms. Okay. So that's basically what defines an addiction from a medical standpoint. And now several studies are showing that an addiction does develop. In adults, it's 1 in 10, which really, if you look at widespread use, and if say let's say 10 million people are using it, 1/10 of that is a significant proportion of the population. And then that gets even worse in adolescents. So with adolescents, the number is actually 1 in 6. So 1 in 6 adolescents can develop a significant life-impairing addiction to cannabis.
Now, people may ask the question, what about medical use versus recreational use? Because I think when people hear, oh my goodness, 1 in 10 people could develop an addiction and 1 in 6 of adolescents, they think, am I at risk if I'm using this for medical purposes? So I want you to break that down. And is there really any difference? And do people who are on it for medical reasons need to be mindful of this risk?
One thing I really, really want to point out, and I'm so glad you're asking me this question, is medical use is used so loosely these days. And so what that is, oh, I have a card to use cannabis and I can pick it up from anywhere and smoke it and use it for whatever reason that was found appropriate. But that is not true medicinal use, okay? I find that a lot of people actually claim medicinal use and still use it for recreational or habitual purposes. One clear indication for actual FDA-approved use, medicinal use, are actually synthetic cannabinoids in a pill form. And there's 3 known diagnoses for which the FDA has approved medicinal use of these cannabinoids. And those are for example, people with HIV that are experiencing anorexia, where they're just not eating and they're losing a lot of weight. That's one indication. Another indication is with intractable nausea and vomiting associated with cancer patients receiving chemotherapy. And the third indication is people with these rare kind of epileptic seizure type disorders, such as Lennox-Gastaut syndrome and things like that. So those are really the three kind of FDA approved kind of indications, medicinal or indications for medicinal use of cannabis. Whereas I would say any other kind of use with the card is not really true medicinal use. And so when people are using it for in that regards, where they have that card, absolutely they have the potential for developing an addiction.
What about, a lot of people think of it also for pain management? And I know you said that wasn't one of the three uses that you mentioned, but I know there is this medicinal use for the management of pain. Does that differ in terms of how you think about it?
So it does. First of all, the use in cannabis for pain is still under investigation. So there's not a true kind of indication for pain. It is still early. It is still under investigation. One use that's really being considered is people that have multiple sclerosis. They develop painful muscle spasms. Okay, and so that's one use that's currently being investigated. Whereas when people kind of talk about, oh, it helps with my pain, one thing I want to point out is that the plant itself or cannabis itself actually has two active ingredients. Well, two main active ingredients. One is the THC, which causes that kind of euphoric kind of psychosis, the kind of feelings that people usually exhibit. But then there's the CBD component of cannabis. Okay, that's the cannabidiol. And so it's been shown to help reduce pain because that actually acts more on our kind of cells of our immune system. Sometimes our cells of our immune system can attack our joints and cause like joint pain or muscle pains and things like that. And so CBD has been shown to actually act on those cells of the immune system to help reduce pain and inflammation. But I caution again, if anything, at best, it's an over-the-counter remedy and that there's no exact prescription or FDA-approved indication for pain.
So if somebody's hearing this today and they're thinking, we gave some of the criteria that may indicate that you have a cannabis use disorder, but I'm not sure. How would I know if I should seek medical help from an addiction treatment center? I know you're the medical director at Laguna Treatment Center and you treat all types of drugs and alcohol addictions. But what would let me know that I need to seek help now?
Sure. Yeah. Well, just think to yourself, is this starting to affect my life in a way that I don't want it to affect my life? Am I failing at school? Am I missing work? Is my productivity at work becoming less? Am I at risk at losing my job because of it? Are my relationships falling apart? Am I kind of losing control of my life because of it? So if that happens, then absolutely seek help.
Now, what would you say to people who say, well, I've been doing this. I've noticed that I have some of these issues that you've mentioned, but can I just stop on my own? Can the majority of people just go cold turkey? Or will they experience some level of withdrawal symptoms? So it's best if you notice some of these things to reach out to a professional.
I think reaching out to a professional is always the best option. A lot of people feel as though an addiction can be overcome by willpower, which is not true. An addiction is a medical disease. So it's kind of like telling people I can overcome my heart disease with willpower. You can't. That's a medical disease. Same thing with addiction. You cannot overcome it with willpower alone. And so that's why you have to seek medical help. And people actually using cannabis regularly, chronically, actually do develop withdrawal. Some of the common symptoms of withdrawal can be increased symptoms of anxiety, depression, irritability, anger. A major symptom is insomnia, actually, because cannabis can help people relax and sleep. And so when they withdraw, a lot of people actually complain of having trouble sleeping. There could be some physical manifestations. They're not as common, but they do occur. Things like abdominal discomfort, muscle spasms, muscle twitching, that can also occur as well. So that just shows you that the body actually does form a physical dependency to cannabis.
Mm-hmm. Now, can it be life-threatening? Can it have life-threatening symptoms? I know you mentioned the depression, and of course, depression can lead people to have suicidal thoughts, potentially in that. But do you feel like the withdrawal symptoms at some times can be life-threatening?
I would say overall, the withdrawal symptoms are not life-threatening. However, if you feel as though your depression is getting so severe that you're starting to have those thoughts of self-harm, then seek help right away. Seek help right away. Okay. But in regards to the actual physical aspects of the withdrawal, so it's not like if somebody is using alcohol chronically long term, that's 100%, that can be fatal because people can develop seizures, people can develop coma, delirium tremens, and death. That doesn't happen with cannabis. So the physical symptoms of the withdrawal are actually not life-threatening themselves.
So what would you say to someone? Because I think a lot of people also have this question. Can someone be dependent but not addicted? And are they one and the same?
So when you say dependent, that's, a lot of people will
Like I have to have
say,
it. Like I just feel like I just need it every day. It's more of a dependency,
"Mhm,
right? Versus maybe is that the same as an addiction? And I want to help people understand that.
yeah. So dependency, such as physical dependency, is only one aspect of defining an addiction. People have to realize that an addiction is way more encompassing than the physical aspect of dependency. And so one thing they have to be mindful of is how it's affecting their functioning, their other domains of life and their relationships, and if they feel as though they've lost control over use of it. And so, yeah, the dependency, especially the physical dependency, is only one aspect of it. And one thing I caution people is don't self-diagnose yourself. Seek help, seek professional help to find out for sure.
Let's talk about professional help. When someone comes in for treatment for this, what does that look like?
So there's different modalities that we use. When somebody struggles with a cannabis use disorder, the mainstays of therapy are cognitive behavioral therapy, as well as motivational interviewing. And motivational interviewing is really just helping somebody understand the reason for wanting to change and to help encourage that. But also, what's an important aspect of treating um, this disorder is, why do they use it in the first place, right? Like,
Mm.
are they using it because they're in pain? If so, perhaps they should see a pain specialist and have that addressed. Are they using it because they're having trouble sleeping? Then perhaps they should see, they see their primary care doctor, perhaps get a sleep study done, or find out why they're having problems with sleep. In terms of medicinal kind of treatments, there hasn't been any real proven medications to help somebody with a cannabis addiction. Um, in passing, some people will use a medication called N-acetylcysteine, which is kind of a benign substance that has been used. But again, the data out there doesn't really support regular use of it just because the results have not been that consistent.
Mhm. Now, do people when you're taking them off of this, is it a cold turkey or is it usually a tapering off of cannabis?
So because we cannot prescribe it legally, it is still considered a Schedule 1 substance by the Drug Enforcement Agency, and so we're not able to prescribe a taper. And so typically when people are coming in and we're treating them, it's cold turkey. And so basically what we do is they're not left struggling with their symptoms of withdrawal. We will use prescribed medications to help them. And as I mentioned before, a big symptom of cannabis withdrawal is insomnia. And so there's certain safe sleep aids that we can prescribe people to really help them with that.
And how long does it typically take people to go to treatment? Like what would I expect?
Uh, do you mean like their duration of treatment?
Mhm. So
Uh,
let's say I realize I have a problem. I hear, you talking about this, and I'm like, you're speaking to me. I feel like this is me. It started to impact my life. I believe I might have an addiction. I decide to go to treatment. How long can I anticipate that I would be in treatment? Does it vary by person or severity of the use, or what do you tell most people to expect?
it really does determine, like, it's really dependent on the person. Everybody reacts differently. And so it's very hard to predict. Whereas I would say if we're speaking only to the physical aspect of the withdrawal with chronic long-term use, symptoms of withdrawal can last anywhere from 1 week to 3 months. And so it really all depends on the individual. And so that's why when people come in for treatment, when they first arrive, they're seen on a regular basis. And that kind of helps us gauge and determine how much therapy or how much treatment they would actually need.
Mhm. Well, Dr. Mitrevolis, this has been so enlightening. And I think this will be so much information for people to absorb and really think about when they may not have known just the risk. So I guess I want to have one final question for you. If there was one message you could get out to the public about this, what would be that one take home message that you hope sticks with people from this interview?
The big take home, I have to say, is that a lot of data is coming out right now showing how regular chronic use beginning in adolescence affects mental health as well as IQ as well as cognition. And so in adolescence, starting use at that age, your brain is still forming. There's still a lot of development going on. And there's good data out there showing that it is really bad for you.
Mhm. So, just a warning or really a wake up call for a lot of people. Thank you so much for joining us on Addiction Talk Expert Insights.